My name is Dr. Amit Mirchandani. I'm double board certified in both anesthesia and pain management. Grew up in New Orleans, went to high school there, went off to college and med school in Memphis, Tennessee. I traveled up to Yale University for my residency in anesthesia, and then went to Rush University in Chicago, where I really became passionate about pain management and figuring out different options for patients. That led me to come down to Dallas and start Texas Cell Institute. My interest in pain management has always been to help patients get back to a life that they want to live, a life that involves functionality, that involves happiness, that involves focusing on the things that they always have wanted to do. I really wanted to use medicine as a platform to really empower patients. So my practice is called Texas Cell Institute. Texas Cell Institute is designed not only as a typical pain practice, but more as a platform to help empower patients with musculoskeletal injury. Currently, the traditional options with patients who have musculoskeletal injury are pretty limited. Patients can undergo conservative therapy with their injuries in terms of ice, rest, anti-inflammatories, narcotics, steroid injections. And typically, after those conservative options have expired, they're typically on the operating room table. Within that, we've bridged the gap with Texas Cell Institute. Now there's a cellular-based intervention option for patients. We utilize the patient's own cells, their own powerful regenerative cells. We process them in our FDA-approved lab, and we re-inject them at an accredited surgery center under precise image guidance to help not only mask painful symptoms for these patients, but actually to help these injuries heal. Patients who come to us, they've come to us for any joint injury that's involving any soft tissue structures, muscles, ligaments, tendons, any arthritic joints, basically every joint in the body, from neck, spine, lower back, you got your shoulder, elbow, small bones and joints in your hands, the knee, as well as your foot. Depending on what patients come to us, what severity of symptoms they come to us, what severity of injury they come to us, we typically evaluate to see how many injections they may need. But there's no rush. You typically start with one, you see how a patient responds, you wait and you go through an entire program, entire process for rehabilitation, and we come back and we evaluate, how have you done? Where do you still have symptoms, and how can you improve from this point forward? The patients who have come to see us, they've been very happy. I think they've been happy for multiple reasons. The first reason is that we take the time to get to know who they are and what their injuries are. We take the time to get to know exactly what their goals are. We take the time to get to know what therapies they've tried and that have failed them. The second reason that they're really happy is that our therapy is superior. What we are able to offer in traditional medicine has a ceiling. It doesn't have the opportunity to heal injury. It only has the opportunity to really mask painful symptoms. However, what we have the ability to take a patient, their injured symptoms that have caused them chronic nagging pain, to an area where they can have a fulfilled life again. Standards in medicine is everything. Having standards in any profession is critically important, but medically, I believe that it is the end-all, be-all. Medicine should be the profession that we all look to hold a standard that is unbeaten. To be a top 10 MD is a step forward, not only for myself and the honor that it is, but I think to be a top 10 MD is a step forward for patient choice. How patients choose their doctors is critically important, and the fact that Top 10 MD validates their physicians to do checks on whether they're board certified, to do checks on the number of procedures that they have experience with, to do checks on their background in terms of malpractice, to do background checks on ethical standards. These are things that need to be transparent to patients. So it's a step forward for the entire healthcare industry.